right, so if a patient comes in and says, Dr. Olson, I want the best hearing aid. What is the best hearing aid? How do you determine what the best hearing aid is?
There's so many things that go into consideration when prescribing a hearing aid, right? So I need to know the level of hearing loss that someone has. Is it high frequency, low frequency? What is the shape of their ear, right? Can they have a device that goes behind their ear? Does it all have to go inside the ear? So, I mean, there's so many different factors that come into play. What I really think that they're getting to is that they want to know the best brand, the best manufacturer, right? They want to know which one of them has the best technology, right? And for the most part, all of them are on the same level playing field. Now, that being said, there's little individual factors or features with each different brand of hearing aids that might suit that person better, right? So a lot of time is spent to identify what are the most important things for you as a patient, right? And then taking those most important things and figuring out which one of those devices will accomplish that goal, okay? That being said, you could probably, and I'm not even going to say probably, you can get a better response from a hearing aid. So you can go with a really, really cheap hearing aid. If that cheap hearing aid is fit really well, you will do better than a really expensive hearing aid fit poorly, right? So we have to kind of quantify, well, what's good and what's poorly, right? And what determines a good fit or a poor fit is best practices, right? So these fundamental core things that need to be done from a physical fit standpoint and a programming standpoint that will determine if you have success with that particular hearing aid. Because so many people think that like, well, I have a really good hearing aid, so that will provide me with the absolute best level of hearing. And it will, right? So the best hearing aid will provide you with better hearing if it's been fit appropriately, if it's been programmed appropriately.
So hearing devices are not just chosen based off of the results from audiometry hearing test.
Right. So
it's also based off of the verbal concerns the patient gives you. They say, oh, well, when I go to church and I'm trying to sing, I can't hear myself sing, therefore I don't sing. I want to be able to sing in church. I want to be able to hear myself sing. So based off of different situations, in your mind, you're thinking there are different levels of technology best suitable based off of what the patient tells you their goals are.
Right, so I think people have a good understanding of percentages, right? So I would say that 20% of deciding which treatment technology, whatever, to go with is based on the hearing test, the actual hearing test that you have done. Critical component, have to have it, right? But 80% of deciding which treatment is right for you is based on these specific interactions, these questions, these things that you want to hear that you're not hearing, right? These certain situations you find yourself in, right? Without that information. So if we just did a hearing test and said, you need a hearing aid and you need this one based off of just the hearing test alone, without getting all of this understanding from what situations you find yourself in, what you really want to hear, then I would question that recommendation.
So I just had this thought. Sometimes people really aren't aware of like themselves and in everyday life situations, and they think, oh, I'm most bothered because I can't sit down and watch like CNN or something. So we come in and we get this test, and then based off of what I'm telling you my concerns are, we choose a device, and then I get this device and I'm wearing it, and I'm realizing that what really bothers me is that when I go watch my grandson play soccer, I can't really hear, and it's hard for me to cheer, and that means more to me than watching CNN.
Right.
But the device I'm having really isn't going to optimize that experience at the soccer game as it does with CNN. So what do we do?
Yeah, so I mean, that is why at the onset right? Even before you have the hearing test, that specific circumstance of what the most important thing is to you should be uncovered, right? You should not be into your treatment or starting your treatment and then realizing, oh, I actually really wanted to hear this thing, right? But my hearing care professional never asked me about these specific situations, right? And so those things need to be identified up front, because to be honest, if you came in and saying the most important thing to me was watching, CNN, Fox News, whatever TV show that you want to hear, I wouldn't recommend the same level of technology to you as someone who's like, I have a grandchild who plays soccer and I can't hear, the people sitting around me asking me questions about my grandson, right? So if I knew that, right, at the beginning, I would be able to advise and prescribe the correct level of technology for that individual, right? So it's immensely important.
So there is a huge value into the audiologist taking the appropriate amount of time, not rushing through this appointment, so they can properly counsel and investigate their patients to get the information they need to make the proper recommendation for me as a patient.
Perfectly said. Absolutely. I mean, the very first time...
So then that's why you're better than the audiologist down the street.
Okay. I've stumbled into the trap. So I believe that everyone has the capability of being a terrific hearing care professional, right? Having a big knowledge base does not necessarily mean that you'll be good at what you do. If you don't employ that knowledge into practice, then you won't do your job very well. So this is the way that I'll phrase it, right? I pride myself on having a really good knowledge base and knowing what I'm doing, but employing that knowledge base to maximize benefit, right? And the way that I do that is I follow best practices, right, which are these fundamentals, these core fundamentals that you have to follow in order to have success, and I do it with extreme amounts of precision, right? So, and when I say precision, I'm talking attention to detail. If you mess one of those fundamentals up, your performance will suffer, right? So that's what I pride myself on, is doing these things and doing them to the utmost of my ability and the knowledge that I've gained over the years, right?
I think that's fantastic. And the audiology community should be fortunate that they have you.
Oh, thank you.
Not doing that.